specialty doctors at the hospice, so I work Monday to Thursday on the inpatient unit looking after our patients there, and I do ward rounds with our consultant Fiona Chiplin and our other specialty doctor Charlotte Fields. And I'm responsible for teaching our GP trainees who rotate every 6 months through the hospice, and we get medical students coming every week as well. I'm responsible for teaching. And then I also link and work quite closely with our hospice community nurses who look after the many patients we've got at home. And so what the hospice allows me to do is it really affords me the opportunity to spend a lot of time with patients, really focus on individualised care. One of the best things about my job at the hospice is that we do go above and beyond for our patients, and we have the ability to do that. So sometimes it's not necessarily the medicine, and it's all the little things like bringing in their favourite shandy, arranging for their pets to come in, for therapy animals to come in. So it's all the little bits on the side that I think make up a huge part of a patient's journey and their care that you just can't offer in a hospital. I have some formal training with ultrasound specific to emergency medicines. I've done a number of specialty courses with respect to that. But then to link it more with palliative care, I've done a specialty course specific to palliative medicine. So there's a formal training course for the use of the ultrasound in palliative care. The idea being that now I'll teach our other doctors in the unit how to use the ultrasound to benefit our patients. We're going to predominantly be using it to look for fluid in the belly, what we call ascites, and that will allow us to, at some point, put a drain in to take that fluid off. And currently we have to arrange for patients to go to the local hospital for that, which isn't sometimes the easiest process to go through, and there can be waits. So that will allow us to do that all in-house, which will be a much smoother process and benefit our patients. We'll also be looking at the evidence of blood clots in people's legs, and our patients are sometimes at increased risk of that. And again, if we are worried about that, currently we have to send people to hospital, and that sometimes might be through the A&E department, which isn't ideal. And that allows us to do and control all of this in-house and making the patient's journey that bit smoother. I'm incredibly grateful to the Albert Hunt Trust for funding my post and allowing me to undertake these courses so that it will really benefit the patients in the hospice and the wider team, that we can work more collaboratively and improve some of the services that we can offer.